All right, one of my weaknesses is being notoriously late, so I'm glad I got to make that intro there. So, in all seriousness, I am Wilfred Reilly. I'm an associate professor of political science at Kentucky State University, down in our state capital of Frankfurt. And as a capitalist, I will note that I am also the author of the books Hate Crime Hoax, Taboo, and the upcoming Lies My Liberal Teacher Told Me, which I do encourage the audience, in addition to perusing the Genspect websites and donation portal, which you should definitely do to check out on my end. And I see that I have the pleasure and honor of being one of the last speakers today, except for some semi-private events, and indeed during the entire event. And I hope, given some of the people that I've followed, that I don't disappoint too badly. So a few quick notes here. First, I don't have any slides. Thanks to James Lindsay, I wondered if I'd be the first person to say that. I will say that if anyone wants a copy of my talk, these are all prepared online, you can just Google me and shoot me an email or come up to me afterwards, grab a card. I'd be glad to talk with any one of you and basically get in touch. I also wanted to give my opinion on a question that another speaker asked earlier today. And as I recall, that question was, this is a war in many ways. Are we winning it? My answer would be not yet, but this is the Gettysburg. The larger side with the better ideas is getting organized now. And when that whole process eventually happens, the outcome in the end is going to be inevitable. Most people know, simply put, that men are not women. And when that response begins to be said publicly, I think the results will be what we all expect. So that's my prediction, and honor to all of you that were on the barricades from the very start. That said, the title of my talk today is The Detransition Time Bomb. And I wanted to take a look at some of the numbers underlying what I think is soon to be a massive phenomenon heading down the pike. And one that we haven't necessarily heard a ton of serious mainstream discussion about. So we often hear, or at least I have, and I'd be interested in hearing whether I'm atypical, but that there are very few or no detransitioners. True detransitioners is a phrase that I've sometimes seen used. I think everyone acknowledges that individual people who have detransitioned exist, often very brave ones like Prisha, who we just heard speak, Chloe Cole, Watson, so on down the line. But this is generally presented as aberrational. So quite major projects, like a recent paper from Jack Turbin, provided an appropriate response, but provide stated detransition rates of 1% or 2%. And American outlets like the Times and the Post seem to be running with these quite non-critically, at least for the moment. My impression is that there's virtually no possibility that those estimates are accurate or close to accurate. To provide some context, literally every surgical procedure that's ethically researched has a known regret rate, which medical practitioners try very hard to document. I don't mean to be glib, but the most recent figure for quote-unquote Brazilian butt lift procedures was 14%. Methodology is not the focus of this talk, but a big part of the problem with virtually all studies in this field seems to be how the data is gathered. Most of them involve gender clinicians surveying patients who are still in friendly contact with them, which is a group that would include almost no detransitioners, very few patients that have fallen into self-harm, and so on down the line. I'm reminded of a very old, very bad campus joke about a psychology professor who surveyed people about whether they liked completing surveys and got a response rate that 15 years ago in my first graduate class, this joke was made. I share it with you today. But, and who got a response rate of 98% yes. Whenever I look at this kind of thing, In reality, if we're trying to get numbers for quote-unquote trans kids and for detrans kids and young people, and that group is really my focus here, there are a few sets of numbers that strike me as being relevant. The first is the overall size of the youth trans population. And as several speakers have already and eloquently noted, that group is growing remarkably. So traditionally, according to the DSM-5, only 0.005% to 0.014% of males and 0.002% to 0.003% of young females, of girls, ever experience gender dysphoria, with only about half of those people dealing with the youth onset version. We've probably all heard the terms insistent, consistent, persistent, some very slight variation thereof, used to describe this syndrome. But the times, they are a-changing. In 2022, according to The Hill, 26% of high school and college-age Americans identified as quote-unquote LGBTQ. And importantly, I think, this increase was driven to almost a 0 degree by what most of us grew up thinking of as regular gay folks. Gays and lesbians combined remained pretty stable at just under 3% of the population. In fact, we seem to be seeing at least a slight decline in the free-range lesbian numbers. In contrast, so about 1.2%. In contrast, 3.9% of all young Americans now identify as trans or NB, non-binary, or other. And another 5.3% identify as questioning one or more aspects of their sexuality or of their gender. That's where the increase has taken place. When we look at plain gender nonconformity, the numbers are even more startling. So according to figures from California, which is actually a large state that's pretty representative for this metric, 27% of kids now say that they are gender nonconforming or gender fluid, or that they are androgynous, per one study of about 1,600 people, 1,594 young people. Now, I am, as you may have noticed, a whimsical person. And to some extent, this can be almost amusing. As most of you know, the social media platform Tumblr became famous some years back for allowing users to choose from among 126 genders, including things like Native American Two-Spirit and sapiosexual. This, in fact, is not a joke. My personal favorite of these genders is demisexual, which refers to people who prefer not to have sex with individuals that they don't have a personal connection with. And again, you can simply Google this. A sign that you might be in this category is that you prefer to go on 2 to 3 enjoyable dates with someone before sleeping with them. Now, a cynic might protest that this category would include 85% of women and half of men, but the science is the science, you rubes. And this can go on and on. The methods we'll begin in a second. But recently, an ambitious young British woman named Yasmin Benoit succeeded in getting the United Kingdom's NHS, their renowned National Health Service, to formally reject the oppression of asexuals. So people who are often disinterested in sex or dating are now a recognized minority, in the way that gay men, individuals with actual gender dysphoria, or for that matter, blacks or whites, would be. I suppose not whites in the UK. Apologies. But I mean, again, the name is spelled B-E-N-O-I-T. That is not sarcasm. That happened as of 2 days ago, just read the research report. So a lot of this, in my opinion, has to do with the almost meaningless nature of the concept of gender. So obviously the hard scientists here, like Dr. Heither Heither, sorry. Don't want to mispronounce anything, but have pointed out that there are gendered traits in nature. There are in human beings as well, in a rather real sense. But residual sex traits in an asexual species are the classic example, if I have that correct. But what modern, quote-unquote, liberal feminist academics mean by gender is almost always just the set of stereotypical traits associated with one sex or with the other. As those of you who follow me on Twitter know, I recently took one of the major gender scales. This should still be on my page about 2 weeks worth of posts down. And basically, the document listed me as a very manly man, which is, of course, accurate, until I answered 4 questions in a row about my feelings on cooking, gardening, relationships, should they be equal, should your partner work, and whether I prefer cats or dogs. And after I gave obvious answers, such as cats, the gender scale, yeah, that's right. Colin Wright, I will note, has launched an initiative in response to Yasmin Benoit, arguing that male cat lovers should be recognized as an oppressed group. And I applaud him. But again, in all seriousness, because this is stuff that's being taught to our young children, after I completed these 4 questions, the survey then informed me that I was a masculine woman. This is a result you can analyze. People who prefer relationship equality, enjoy cooking, and like cats are women. That is what, in the simplistic sense, online, in the schools, gender means. This is important to process. There's not a deeper conceptuality underlying that. So it is a funny, silly concept in a lot of ways. We can have fun with it. I'm not the first speaker to do so today. However, at a deeper level, the growth of the gender idea and of the trans youth population isn't amusing at all because of what it implies. The problem is that we are still treating gender dysphoria as the rare and intensively medicalized condition that it was when just 0.005% of people identified as suffering from it. And there is a formal and heavily medicalized, again, pipeline that many or most of these kids are about to be shoved into. And this gets into our second set of numbers. So it has historically been fairly difficult to get the data on gender medicine treatments for under 18 minors. However, Reuters recently ran a surprisingly honest article on this topic, Rates of Gender Medical Care for Minors, I believe was in fact the title. I would encourage you guys to check it out. And I was able over the past couple of days to dig up several of their original sources. So as far as anyone can tell, 121,882 children, 121,000, between the ages of 6 and 17 were formally diagnosed with gender dysphoria between 2017 and 2021. Given that that number increases every year and that there were 42,000 such diagnoses in 2021, we've probably seen another 85,000 to 95,000 kids diagnosed since 21. Again, all of these are minors at least 1 year below the age of 18. Of those kids, according to the follow-up on the figures in the article, we know at least 633 were placed on puberty blockers or chemical castration drugs in 2017, 759 in 2018, 897 in 2019, 1,101 in 2020, and 1,390 in 2021. Assuming an average year-over-year increase of 189, which is conservative because this is in fact expanding annually, you'd expect about 1,579 kids on PBs, puberty blockers, in 2022 and 1,768 in 2023. More young people, in fact, were given sex hormones like testosterone and pure estrogen. Those numbers were 1,905 in 2017, 2,391 in 2018. Again, this is all available if you email me for the Excel sheets. 3,036 in 2019, 3,163 in 2020, and 4,231 in 2021. Assuming the same annualized rate of increase, that would be 4,817 new patients in 22 and 5,393 in 2023. There certainly also are top and probably bottom surgeries, although I was not able to find reliable data on that, performed within the same age group. By the way, this wasn't the focus of the piece or of the sources, but the bare minimum figures that I obtained were 238 for 2019, 256 for 2020, this would be for double mastectomies in this age category, and 282 for 2021. And again, we see a pretty steady, what you'd call an increase curve there. Unfortunately, this all goes up very predictably every year. So several things are notable here. First, this data gives us a pretty good estimate of the number of young kids. You're talking about 16, 17 or below, down to 6, children is a very reasonable label here, who transition beyond the sort of, quote unquote, wear my hat backward stage. This would be non-social medical transition. So of the 122,000 kids, just using the years that I have absolutely certain data for, we saw 4,780 puberty blocker prescriptions, 14,726 sex hormone prescriptions, mostly testosterone, mostly to girls, and 776 top surgeries. And that gives us a figure of about 20,282. That's 16.65% of all young people with gender dysphoria for these sort of formal, very difficult to redo should you change your mind transitions. And second, this is a bare minimum figure. So Reuters notes pretty frankly that these totals only include gender work that was fully covered by insurance. I actually contacted my personal physician about this. His estimate was that's a 50 to 70% underestimate. Not my field, but that's probably about accurate. I've seen some of this on the business and legal side. If we accept the lower 50% figure, 40,564 kids would then have transitioned beyond the social. So it's a fairly large and trackable population of people. A final point here, which is almost an aside in this kind of context, is that prescriptions for hormones were higher than those for puberty blockers in almost every year. And so far as I can tell, those prescriptions seem to reflect mostly a past cohort that was on puberty blockers, as well as some new initiates, of course. But this is very important because it's a direct strike at one of the key points about puberty blockers in the context of young people, which is that they're easily reversible. This is a temporary step. In fact, no one quite knows what puberty blockers do from the literature that I've been able to peruse. And as the invaluable Abigail Schreier pointed out, what empirically seems to be the case is that almost literally 100% of the people who get to that point of transition, it has to be at least 90%, go further. So you cannot, it turns out, simply push the pause button on life without consequences. We don't yet know how humans work. So now a third set of figures. The reason these massive numbers, and I'm going to close with a positive message. The reason that these massive numbers, like 40,000 for hard transitions, are so troubling is that we've known literally for years that most gender nonconforming or gender dysphoric kids, not all, simply go on to be gay. We have those numbers too, as it turns out. So according to sort of the OG serious academic study here by Walian and Cohen-Kitness in 2008, only 27% of a sample of gender atypical 5 to 12-year-olds, which again are boys who like pink and that kind of thing at that age, remained at all dysphoric after puberty. And to quote, of the 27% who remained dysphoric after puberty, most simply developed a homosexual or bisexual orientation. That is to say, many of them never had gender dysphoria at all. They were simply gay kids who at that time in history were allowed to go on and live as gay adults. So 13 to 14 years later, by the way, a whole research team, Singh, Bradley, Zucker, and their various et al.s, published the results that they obtained from studying a large cohort of about 140 gender dysphoric boys. The average age was about 8. And by the time they were 21, and I can't overemphasize how important actually going back years later to check on your patients is, only 12.2% of the boys remained dysphoric. And this time, as I recall, they were all gay. So again, at least if I recall correctly, okay, so I already said that. So we have two things going on here at the same time. We have 120,000, perhaps as many as 200,000 children being diagnosed with real medical, psychological gender dysphoria, and thousands of them, 20 to 40,000 so far, being operated on. And we have data showing that most or all of those people would go on to simply become gay men or prince if they were allowed to live on their own. So to say the obvious, given the title of my talk, this dichotomy creates the possibility, I would say almost the inevitability, of a large population of people who are down road going to be very regretful about what they've done and consider fully detransitioning, if not more tragic personal options. So to say something less obvious, I think we're already seeing this happen. I just think that, quote unquote, proper academics and mainstream media journalists are politely ignoring it. To give the most obvious example, if you just take an online trip over to Reddit, the single forum r/detrans, which has been mentioned a couple times so far, has yesterday 51,000 active participants. There seems to be a lot of insistence online that these people are, again, not real detransitioners. But again, if you just contact them using a computer or a phone, there's no evidence of that. They poll their user base all the time, it turns out. And the 2022 poll, which several thousand people voted in, indicates that 44.1% of all forum participants are detransitioners. Another 11.7%, almost 12%, are considering a detransition. And the remainder across the map, allies, feminists, trolls from the political left and the hard right, etc. But as far as anyone can tell, about 60% of the forum is pretty much exactly what it purports to be. And figures like this let us estimate a fourth and final set of numbers, the size of the detransitioner population. So at the first and most basic level, and at this point I'll try to move through the math equations fairly quickly. This would be the one thing that slides may have been useful for. But at the first and most basic level, 44.1% of the 51,000 people on our detrans is 22,447. Just assuming that's representative, that would be the number of detransitioners so far. 57% of the same number is 29,013. And again, that sounds like a lot more than a 1% rate of regret. But at a deeper level, we can compare those numbers to the percentage of people ever to transition beyond socially. We know so far about 120,000 people, young people, were diagnosed with gender dysphoria before 2021. We can add about 85,000 more, as I said, 42,000 per year in 22 and 23. So call that 205,000 people that have so far medically, semi-formally transitioned. And this is heavily a youth phenomenon, but hell, double that to reflect other transitioners, older people. So there may be 500,000 Americans with some kind of formal diagnosis here, which is what you would need for any kind of medical treatment. And we know, using the estimate for underreporting that we talked about earlier, that 30% or so of these people, these are all obviously estimates, but have undergone surgical or chemical treatment. So if a fair final estimate for transitioned trans people is 150,000, 29,000 detransitioners would be almost exactly 20% of that, 2 people in 10. Again, these are all to some extent educated guesses. But also, again, all this sounds a lot more likely than mantras like no one regrets life-saving, gender-affirming care. So, and another even scarier way to look at this is to run basically these same numbers in the opposite direction. So if just 3% of the 105 million Americans who are currently aged under 25, which is about the figure, ever identify as trans, and just 10% of them ever truly transition, and just 3 in 10 of those ever fully detransition, that's 95,000 people, minimum. Not 1 or 2 or even 1 or 2,000. Now, again, one of the things that I'd like to do here is actually find out to a point of real knowledge what the real figures here are. So as Christina Buttons already said, I look forward to working as one of the methods and institutional review board guys on what's really her project with Colin Wright, also here, I believe Lisa Littman, and getting some more definite knowledge of something that is so obviously going on. I will note, by the way, that something very much like this was the inspiration. See, I have -6 seconds. So I'll say this and then shut up. Something like this was the inspiration for my first book, which, as I mentioned, was called Hate Crime Hoax. We were seeing these constant stories of bloody racial conflict on the news. Jussie Smollett and Covington Catholic and Yasmin Sweet and so on down the line. And then you would notice several days later or several weeks later or several months later that almost none of them were real. There was obviously a phenomenon that was simply not being discussed, but that existed. And that was not being discussed for very particular political reasons, and I feel the exact same way here. To put all of this in context, the total number of lobotomies, transorbital lobotomies, ever performed in the USA was about 10,000. In my professional, if out-of-field opinion, we're quite probably looking right now at the development of one of the great medical scandals of our time. And I would say that itself is obviously not a good thing, but looking around the room, I do feel some hope about the response. So kudos to all of you for talking about it and thinking about it and standing up to it, often very early on. That is it for me. I'm open for questions if there are any.
I read the Reuters story, and they got a hold of an amazing database. I was wondering, is there any organization who could buy that same database? And could we look at how many people who go on cross-sex hormones later stop?
Yeah, well, one thing I would say is, in terms of what I did, there's nothing really magical there. I mean, you can just look at a source article like that, see who they used as sources, contact those academics, and yes, I mean, you can literally take that data. If the original researcher is comfortable with you having it, you can save that online, you can write with it yourself. So yes, I think that in very many cases, these figures are out there. There just hasn't been a whole lot of interest in working with them. I mean, in terms of r/dtrans or one of these forums, I mean, you could develop the methods here, but you would simply contact the moderators, access the population there, and ask questions about what, for example, led people to want to transition. I mean, Christina pointed out earlier that a very, very high percentage of female transitioners seem to be autistic girls. So I would assume there are also a lot of comorbidities with other mental health conditions that aren't being treated. Again, not my field of expertise, but there's virtually a 100% chance of that. You know, and so the total affirmation model would in fact prevent the resolution of any of those problems, as many of you know very well. So all of those would be issues. I think you could look at why people transitioned, why people detransitioned, all of that. It just requires acknowledging that the issue exists.
If I might just add to your question, actually we know quite a bit about detransition from scientific literature. Last year there was a study published from a very comprehensive US database, and we should all know what the problem with the US healthcare databases are, is that we have a disjointed system. We don't have one centralized place. However, all insurers have to send their claims through a data center, and there are entities that purchase that data in bulk and process it. And yes, you can partner with those organizations and do data analysis, but it's still very messy and complicated. However, we have a couple of systems in the United States that work just like Europe, and so they're enclosed and they have all of their data, and they don't lose patients. And one of them is the military data system. And the military data system published 2 studies last year, large studies, where every single patient was analyzed, so they didn't lose anybody, and they reported a 30% medical detransition rate, within 4 years of starting for young people. So that does not mean all 30% regret it, but we do know they started cross-sex hormones and then they stopped it, and it's very reliable data. Now, it needs to be shown in other databases, but it's actually not a terribly unrepresentative data set because these are just children of military people. Okay, and so and the second study that came out of the same database analyzed mental health outcomes from that same military health system, and it showed those who underwent transition, their mental health outcomes did not improve, and in many times, actually, they worsened. They ended up on more psychiatric drugs and more problems. So those two taken together do confirm what our last speaker is saying. The wave of detransition isn't just coming. It's already here. It's just nobody's acknowledging it.
Yeah, thank you for that comment. I mean, there's not really much to add there. That's just a note on the methods literature. I had actually read only one of those, so thank you for the input there. 30% seems fairly reasonable. I mean, the estimate range I reached was 17 to 32. If you go into the poll on membership at the top of the major detrans forum, and again, there are questions about representativeness with anything like this, any non-truly large and non-national sample, but there were fairly similar figures of 44.1 to 44.2% of people were detransitioning. Now, obviously, this is a very selected sample, but they break that down further. I mean, 28.5% of them had taken testosterone or another hormone supplement and had stopped it. This was of the overall sample, not of the group detransitioning. So, I mean, it's intuitively pretty obvious that you're not going to get an actual rate of desistance by looking only at patients that keep going to you for the product. So there seems to be, I would actually say that with a lot of research on the academic left, there seems to be almost a very conscious attempt to avoid finding something. So you find these studies like, if we don't adjust for age and crime rate, higher arrest rates for African Americans can indicate only racism. And I mean, if you ask a question like, what about Asian or Nigerian Americans, you'll just be described as a bigot and sort of shunted away. I mean, the simplest way to handle this is just to adjust for age and crime rate and publish it, which is actually the thing and I think many of the others in this room have decided to start doing. I mean, I think it was Colin Wright, Dr. Wright, who mentioned it sounds absurd to be writing book chapters arguing that there are two sexes. But yeah, I mean, you need something to cite if you're the person arguing that there are two sexes and you're in an academic or public intellectual environment. So yeah, I mean, I actually did the articles. Myself and Bob Moranto did Black Lives Matter, Save Black Lives, where we looked at the specific things that I'm discussing and then asked the question of, does that gap still exist? And of course it doesn't. I mean, the modal average age for a black man in America, as I say in every third speech, is 27. White guy, it's 58. I mean, so you're going to see some differences in police encounters between those two ages, assuming everything's going well in life.
Jamie Reed, the whistleblower from the Pediatric Transgender Center in St. Louis. I just wanted to add 3 numbers for your data to think about. So GEMS, which was the first clinic in Boston, said that in their first 5 years, they medicalized 70 children.
Okay.
I have been criticized because I decided to actually keep statistical data from within the center that I worked in. As someone with a Master's of Science in Clinical Research. In a 22-month period, we medicalized 604 individuals with 9 pending initiation. Of that, 444 were natal girls and 160 were natal boys. We lost 30% of everyone. We completely lost them, not 5 years out, not 10 years out. Within the first 12 to 24 months, we completely lost them. And we lost them using Epic, and anyone who knows Epic, there is an entire system where you can actually find out if somebody received care within the whole Epic system. So we didn't just lose them to us, they were completely lost. So in my basic data, there is an immediate 30% detransition rate who might even be staying on hormones maybe a year, maybe 2, and are completely stopping.
Well, first, give the last questioner a hand for what she did. And yeah, it seems like the methodological points are pretty similar. One clarification, 16.65%, which I said to 32%. That was the percentage of people who go through formal medical treatment after a dysphoria diagnosis. That wasn't the detransition rate, which was almost identical, but I did want to clarify that. But then you heard a suggested rate of 30%, something very similar there. So yeah, I mean, the real question isn't whether it's 25% or 35%. I think it's how is society going to handle the backlash that's going to come down the pike from parents, feminists, ordinary citizens, many other people in a couple of years. And that really, I mean, I mentioned a lot of numbers, that's kind of the thing I do, but that's really the issue to touch on here. We can't just keep ignoring social problems because they don't fit popular narratives. Good. All right.